The APCD is one of the most robust data sets I've had the opportunity to work with. It's incredibly comprehensive in the data that exists within the APCD. You're able to track an individual over time and across different insurances and even across different types of data within the APCD resource. So we have insurance claims and birth certificates and medical marijuana card information, and the ability to link individuals across those resources is incredibly valuable. So most of my work is related to perinatal health disparities. So I actually use the APCD for my KO1 award. So it's a 4-year award from NIH, the National Institute of Health, to evaluate largely predictive models for low birth weight, and I'm trying to come up with fair predictive algorithms. With respect to the analysis itself, there is this hash ID linkage across these data sets that allows me to link the data, the birth certificates, to the insurance claims. The ability to link the claims data to the birth certificates is the biggest asset to my project. The APCD is such an integrated resource and is able to capture data from lots of different sources that I guess prior to the APCD you would have to obtain each of those sources yourself and get the data use agreements to link them. You would have to get a data use agreement with the Department of Health, who maintains the vital statistics or the birth certificates. It would be nearly impossible to probably get the insurance claims from each individual insurer in Arkansas, and that's facilitated within the APCD. You perhaps could get it from one insurer, but it would be nearly impossible to obtain the claims from all the different payers. But that's already been done for us through this particular resource. As a faculty member at one of the ABI institutions, I'm able to very quickly get access to the data. We submit a data request and we have access within a week or two. For me, the most valuable insurer in the claims is Medicaid because of the high rates of perinatal outcomes that we see in the Medicaid population. So that's an incredibly important aspect to me within the ABCD is we have all the claims for all Medicaid enrollees in Arkansas from 2013 to present or to last year. I would say I have 2 major tips for people who are new to using the APCD. The first is consider team science. There are folks who have used this data before. There are people who are clinicians who are experts in ICD codes. So come up with a study team that is able to allow you to have support from a claims analysis side as well as from a clinical side. The second thing is to visit the APCD website. The APCD website that ACI houses is a phenomenal resource. They have one of the best documentations that I've experienced with data resources. There's data structures and information about each of the variables there. There's tip sheets. There's the ability to contact the ACI team nearly immediately for questions. And then there's a whole host of recorded lecture series that have the slides available as well as the YouTube links. You can get up to speed very quickly on how to use the APCD. And what ACI does a lot is they listen to their users and they come up with ways to fix problems to help other researchers. We've come to ACI with different questions or challenges, and they've come up with solutions to help us mitigate those issues, and then other researchers can use those solutions as well. So I don't think that the project I'm doing could be done to the scope that it's being done without the ABCD.